Hello, wherever you are watching, and welcome to Child Rights Now. This is a program that aims at discussing issues children rights in Kenya and across Africa. We shall be looking at the trends on children issues across Africa and the globe and in Kenya. And joining me today in the first episode of Child Rights Now is Mr. Elijah Bonyo on my far right. He is the head of a secretariat at the Joining Forces Kenya, our Joining Forces Alliance, and at the middle is Mrs. Martha Sunda from Child Rights Kenya, Childline Kenya, sorry. Welcome, karibuni sana.
Thank you.
Feel welcome.
Thank you.
So this is our first program, and I'm so excited and I'm so happy to have you guys here, a champion for the rights of children. Mr. Elijah Bonyo, briefly, how do you look at child rights in Kenya? Just from your own perspective, are we at a point where we can say that children rights have been realized fully, or we still have things that we need to work on?
Thank you very much, Collins. Child rights in Kenya, from my perspective, I think we've made good progress. If you compare the situation in Kenya 10 years ago and now, there's good progress on a number of rights. If you look at the right to basic education, for example, there's very good progress. If you look at the right to clean and safe water, there is progress. If you look at the right to child health, we have good process. However, we can do more. Yeah, so progress is there, but we can do more.
Okay, there's progress and we can do more. How about you, Martha? What is your own assessment of implementation of child rights issues in Kenya?
In Kenya, I work in a service-related sector where we provide services to children. And these are children whose rights have been violated sometimes. And so we seek to demand from the duty bearers that justice is served on their behalf. And so from experience, we note that Kenya as a country has some of the best legislations in the world with regard to children. And they provide for these rights for the children. But implementation of the same is wanting. There's a lot more that can be done. And so you will find, for example, even the children themselves and the families within which, or communities within which they exist, do not even know some of these rights that they're entitled to. So that knowledge level is limited. Some of the duty bearers are also struggling with what is provided for in law in terms of child rights. And then even those who know struggle to actually implement it. Because you might find there's some conflict within one law and another, or the evidence, how to collect and preserve evidence is a little difficult for some. For example, when you're dealing with issues of online safety for children. And so even the duty bearer, as much as they might know about the legislation, they are hindered from using that to protect this child or to provide or to serve justice to this child. So the issue of knowledge and the challenges around just the environment that allows for implementation or delivery of these rights to the children is also a bit wanting. So there's a lot of work that still needs to be done in that area with regard to child rights.
Mr. Elijah, Martha has mentioned something about, yes, she works at a service, like service delivery, where she gets maybe in touch with people from different places through phone calls and all that. Now, from your point of view, the organizations you represent at the Joining Forces, most of them work in at the local level, in the villages and all that. Would you say that we've fully implemented child rights? You've mentioned something like education that is doing well. For example, in Kenya, somehow doing well. How about other things? What are the impediments that we are facing as a country?
Yeah, thanks. When you talk about progress, progress from whose perspective? From the children perspective, I still want to say there's progress on education. we talked to children, I think sometime last year, and we asked them, among all your rights, which ones do you think the government is fulfilling? And they ranked education as one of it. So yes, from our perspective, we could have a different way of looking at it, but from the children themselves, the beneficiary, education is one of it that they're saying the government is doing very well. However, there are other parts of the country that there are concerns around the same education. Children would be saying education, they're enjoying education because they're able to go to school, right? But as to whether they're learning or not is another matter. As to whether their progress is being tracked is another matter. So we have been tracking progress based on data. I can tell you for sure, before devolution, we had a challenge with education at the pre-primary level in terms of enrollment. With the devolution, county governments have done pretty well, and there's good enrollment at early childhood development level, pre-primary education. However, in ASAL parts of the country, there are those children that are unable to go to early childhood centers, some of the reasons being the distance to those centers. You can imagine a child of 4 to 5 years having to travel several kilometers. So one of the hindrances to access to basic education at pre-primary level is the distance. The second issue that is contributing to these challenges is the household level situation. There are families that go without food, right? So when children go without food, even if they loved going to school, they will go to school anyway, and they will not concentrate. But there are those who go to school, some of those schools have feeding program. So sometimes you hear children say, I would rather go to school because you're going to have feeding program in school. When the schools were closed, some of the children were telling us the reason why they really wanted the schools to be open was because of feeding program, right? So education, we could be looking at progress in education, but unless we address the household level food situation, we still may not be able to confirm that all the rights are being fulfilled. Apart from education, go to the health sector. We know government has a free program for health for children. And we know that NHIF, for example, is being given to children in high school. So we've been asking ourselves, how come children in primary school are not entitled to NHIF? Go to a secondary school now, when children are well, they're likely to go to the hospital because they're entitled to NHIF, government paying. But children in primary school, the parents still must take care of them. Now, a child who is above 5 years, you know, some of them are facing challenges accessing medical services. The third thing that I can say is the right to participation. You know, sometimes when you look at children's rights, we forget that basic right to participation. Are their voices being heard in decision making? Now, a number of them are aware of their right to participate, but they're saying they are not having the spaces to participate. There are a lot of things that are being done are top-down decisions. We like you to do A, B, C, D, but no one consulted them that needs to be done. Thank you.
Wow, that's amazing. And also, and you know, Martha, he has mentioned something about child participation actually, which is actually important in all these areas that he has mentioned about health, provision of education and all that. And you know, a child must be involved in the like key decision making. And in your perspective, you know, do children have to participate?
It is important because remember, as children, okay, we set the pace for adulthood at the child's level, you know, so we start young. You don't grow up and then suddenly you're thrown into a space and you need to make decisions, you know, be involved in certain things. Well, it is possible, but it makes better sense when you start when they are younger. And part of the reason then that we advocate for child participation in their small spaces, but it doesn't have to be a big platform, even just at home. It's important to give them the opportunity to decide, for example, give you suggestions of the menu, you know, basic things, or which chores they want to be involved in and when, you know, so that you don't force things down their throat. They also have a voice. They might tell you something and say, maybe we can do this rotationally, or I can do this part and the other person does that part. They have already, they start conceptualizing responsibility, allocation of duties, teamwork quite early. So participation in that sense is very critical. Now, even at the helpline where I work, we allow them to therefore amplify their voices. Because they can call and talk on their behalf and just say, I am uncomfortable with this situation. Then they explain to you what the situation is. You can engage them to give you possible solutions, and they have solutions, by the way, sometimes. So they'll propose. They will tell you, I suggest you have a chat with my mom about ABCD, and then after that, based on how she'll respond, you can loop me in. You know, they have already given you, they have made a certain level of decision, you see. And growing up, that child will take more responsibilities, make more decisions for themselves and others growing up. So the place of child participation at all levels of childhood and beyond is critical for us as a country and globally as well.
So what you're saying is you've been able to engage children at your helpline. What are some of the things that children maybe ask you? Is there anything that children ask you about government and education provision or services or anything around that?
Sometimes, because when they're troubled in school and they're raising the concern with you, they're actually saying that they're not satisfied with something. Either the way the school program is structured, or like now we have gone back to school after the long COVID season. And so there's this overwhelming content that is being given to children within a very short time. So they'll call you to say, I am overwhelmed. This is not working for me. You know, they've already given you feedback about government's role in determining how they engage within the school community. They'll tell you, I am unwell. I can't access this service in hospital. I am over 5 years old. So I am not within the bracket of 5 years and below to get free medication, but also my parents are not able to afford my medication, you see. They have already told you a lot of things around government decisions and structures around health for the child. You know, so mental health issues. For example, I'm struggling with anxiety, I'm struggling with peer pressure, I'm struggling with suicidal thoughts, things like that. The country generally doesn't really have a well-structured way of responding to such issues. So you already are seeing, and they're giving you feedback about how all that is structured and provided for. So such are the things that they raise with us. And so in our data sets, you'll have issues of violation, violence against children, and abuse. You will have issues where they're asking for counseling or other psychosocial support, maybe access to medication, education, things like that. Then you'll also have some of them just asking for information so that they understand why is this happening the way it is. Like during the COVID period, a good number would call and ask, why do I have to wear a mask? Why can't I go out to play? You know, so you get then the chance to educate them on, all of us are doing this so that we protect ourselves and other people against COVID. So you have that opportunity to also explain, so what is COVID? You know, so it's a whole mesh of many things.
So, Mother, before I come back to you on that issue, so that you tell us what you do with that information that children give you. Let me hear from Elijah. How important is it for if when it reaches a point where children can freely share with us the information maybe regarding their rights?
I think the first thing that Martha raises, which is important, is access to information. You know, we are talking about children now. How many are they in this country? You know, we had census done in 2019, and the report was available, I think, in 2020. So how many children do we have in the country now, based on the census report and the projection? Are we able to look at children across age groups? And then we look at whatever age group, what information do you need to access at a particular age group? And are we able to look at them in terms of male and female in terms of access to information. What information should be provided readily to all of them, and which one do you want to prefer to give more of it to the girls and more of it to the boys, and what is the reason for that? And how about children with special needs or children with disability? For example, if I'm a child with disability, there's a likelihood that I'll be struggling to understand why am I different from other children.
Yeah.
So who is this who readily begins to give me information about my situation? At what age am I being told you are deaf? And I begin to understand I am deaf. Or at what point am I being told you are blind? And I begin to understand what that means. Right? And once I'm being explained to that, at what point am I being told my entitlements in terms of service delivery? Right? So for me, I think access to information is very critical, because that is what makes the children to begin to engage with other children having appreciated their own situations based on what we call age-appropriate information. We have children who go to public schools, others go to private schools. Perhaps they're asking, why am I in a private school? Maybe it's the parents who made a decision that you go to a private school. And another one is asking, why am I in a public school? So we need to let them know that public good, it's a government responsibility to provide education, for example. And the government provides education through a public system. So that they begin to understand, okay, this is what it means. Healthcare. Some children are in families that have access to medical insurance, others do not. So a child will be saying, why I went to this kind of hospital. But another one is struggling, saying, all the time I'm sick, I've never gone to that kind of hospital. But the reason behind is because your parents have access to medical insurance. That's why you go to these ones. This one do not have. Then it comes to violations. At what point do we begin to expose children to what we consider an abuse? So that they begin to be aware that this is an abuse. So therefore, this cannot be entertained, and this is allowable. So I think we need to do more on access to information, and we need to start sharing with children data around their situation. You know, if we are saying that, for example, some of you are in school and others are not in school, how can we explain to them, using the class register, for example, that you are 40 in a class, but you are realizing you are never 100% attendance, what that does mean for them. It empowers them to begin reaching out with other children who are not in class to be able to join class. So back to what we are trying to discuss here, I feel strongly that we may need to relook at how we are putting together information that children are going to access. Do children know how many there are in the country? Perhaps they know the ones in their village.
Yeah.
But if you ask a child, how many of you are you in this estate? They just know we are children. But there's data that tells us up to sub-location level the number they are. So we need to start making children appreciate their numbers to help them begin to engage. They can say, we are 100 of us, we need a football pitch. We are 200, we need a playground. So let's use the available information from Kenya National Bureau of Statistics around the numbers to share with children for them to be able to have the information to enable them participate.
All right. Thank you very much. I think we'll share more about information and the numbers. Let's take a break. Then when we come back, we'll delve deeper into data and how this data can be used to better the lives of children. And also we'll also be answering the question on whether we actually have data and reliable data that helps in informing decision making around children. Thank you very much, and we are continuing with this conversation on children's rights in Kenya and the implementation. We are tracking the implementation of children's rights in Kenya, and today we are basically laying the background on children's rights in Kenya, and now we are moving to the aspect of data. And as you know, for anything to be implemented, for any decisions to be made, there has to be data. And from education to health and to child protection, there has to be data involved. Now, let me come back to my panelists. Of course, data is very important. And maybe I want to hear from Dawn. Do we have reliable data as a country that really helps us in making decisions? Because we, every year, let me say, for example, the ASAL communities and all that, you'll hear that, there is census reports that are being given when we know that there is this number of children, maybe in the ASAL regions and all that. But somewhere in the middle of the year or towards the end of the year, you'll hear there is drought and there is no food. So what's the problem? We have data, or we have reliable data that helps us make decisions for children and for the rest of the country, or what we have?
I think the capacity to generate data is available in government, and there's no other credible source of data in this country apart from government. Anytime you talk about data around children, when children are born, it's the government that gives the birth notification.
Yes.
So that's government source. It's the government that gives the birth registration certificate. That's government source. It's the government that enrolls children in schools. So that is government source, right? It's the government, again, that treats people in the hospital. And then we have the government leading the national census. So in terms of credibility, for me, I believe strongly the data is credible. There is no other capacity that we can talk about to give us different data apart from government. Why I'm saying this, I've looked at a number of researches done, reports by private sector or university students or NGO. Oftentimes, they still quote government data. And I'm yet to see any institution that can do a massive countrywide data collection analysis than government on children matters. I'm yet to see that. And where we have a problem is that we are yet to put a national status on the situation of children informed by data. So we'll have education data somewhere, food security data somewhere, health somewhere, but you're yet to analyze this in a manner that we are able to show how the data from the food security sector contributes to decisions in the education sector. So we have the data, but we're not utilizing properly for decision making. Where we have drought, for example, as you say, there's normally the short range assessment and the long range assessment that tells us how many people are at risk of hunger, how many children are having malnutrition related issues. But how do you use that? I think that's the question. It's an area of improvement because for many years we keep on having these surveys being done, but we never narrow down to how is this data helping in resource or investment to address the problem. If you know in this particular community, this is the number of people, this is the acreage they have for food, for example. This is the rainfall pattern. If you have to put a major irrigation program, why are we not putting an irrigation program that responds to the needs of these people? So data is credible, the data is available, utilization of data in decision making is where I think we need to improve. Nationally, we have the National Council for Children's Services, which ideally should be putting together the national situation of children, and the National Council for Children's Services then should be advising these other state departments on the right interventions for children matters. I'm yet to hear the National Council for Children's Services, for example, pronounce themselves on the issue of droughts, so that they can say, yes, we have a drought in the country, there's evidence there's drought, but from the National Council for Children's Services perspective, this is what this data means for children. The education department, there's data around enrollment, dropout, all these things. But the key institution that then should pick the education data to inform the country, there is still an area that requires a lot of improvement.
Okay.
Thank you.
Okay, so is this data accessible?
To some people, yes. And what I'm saying to some people, you know, you can walk to the National Bureau of Statistics today and just go in and will be given the kind of information you require, right? Go to town tomorrow, go to the National Bureau of Statistics, just ask for what you want. You'll be given whatever data you require. So it's accessible to those who need it. The challenge could be, maybe not many people are aware that the National Bureau of Statistics is open 24 hours and you can always go and access what you want. They can actually even analyze for you data further depending on your interest. However, the National Bureau of Statistics is not available everywhere in the country. In their website, there's some information, but it's not to the detail that we may want to. Look at the other day, they released the economic survey. It gives a lot of information that helps people to make decisions. But people who are not closer to the city may not quickly access that data if it requires physical movement. Online data from government, again, is not readily available. But if you need it, there's a way in which you can write to those ministries that they're able to give you data. So the National Bureau of Statistics, the Ministry of Planning, the National Treasury, accessing information is pretty easy. These other ministries, there's a problem.
What are the other ministries?
Okay, if you narrow down to children matters, if you want to know the number of children who are at risk or children who are pregnant, for example, so that they're assisted, like Martha says, you know, the only proof of pregnancy is the Ministry of Health in the health facility, right? Now, they have a system that then records a number of adolescents presenting themselves with pregnancy, for example, but you will not be able to get that data as a ordinary member of the public, because I think that data safety concerns. So, whereas Martha and other stakeholders would be interested to intervene around the needs of children who are pregnant, for example, they may not easily get that data from the Ministry of Health. However, for response, as you were saying, children in need of care and protection, ideally we should be getting their data from the Department of Children's Services. Now, if you go to the Department of Children's Services today, they'll make reference to the Child Protection Information Management System, right? Which you can go and see. Actually, you can see the dashboard, how the data playing across a number of parameters. Now, when you go to the community, you are supposed to get that from the normal government structures like the Assistant Chief's Office, the Sub-County Office. So if you're interested in data specific to your community, you'll not be able to access it easily at the national level in the system. When you go back to the community, the institutions that down there will still not be having it because they don't have the tools. So the Ministry of Health data is not readily available to the chief. The Department of Children's Services data is not readily available to the chief. But the chief, the person that the people want to interact with. So to some extent, depending on whatever data you require, I would say yes or no, because there are those that you can access, there are those that you may not be able to access to make decisions. But the basic point for me, we have sufficient data in this country. Sometimes I wonder why we must continue doing a number of surveys. In whose interest are we doing surveys? What do you want to do with those surveys if you can't use them to make decisions? A number of agencies are doing surveys, researches every year. If these pieces of research cannot inform decision making, then you have a problem. Remember again, if you're not a government institution, we have the NACOSTI that provides licenses for research, just to ensure that our researchers are credible. But how many of the research we do in this country or data we collect passes through that process? Okay. Not many.
Okay, since we are more interested with, we do more, like we have more researchers than what is happening on the ground. So, Martha, part of what you do is direct interaction with callers and all that.
Yes.
What do you do with that information when maybe a child comes to you and tells you there is this and this happening in my home? What do you do with that information?
several things. In the immediate, that information is important for us to be able to respond adequately to this child because it tells you what the presenting need is, and on assessment, what are the underlying issues that need to be addressed for you to fully deal with the presenting issue at that point. So it is important to make use of that data that way for holistic response to this child. That is one aspect. The other way we use the data is to share with various partners, both state and non-state, to inform policy, for example. That, for example, FGM is truly an issue. These are the trends that are presenting, these are the areas that are affected, these are the children that are affected, you know, something like that. So that can be used to provide evidence to push for a certain agenda in terms of policy formulation or adjustment. And then the data is also useful for implementation or programs, for example. So if Kajiado, for example, have an issue with child labor, then it wouldn't make a lot of sense to set up a program there tackling defilement, while the issue from the data sets or the trends that are being presented through the data show that it's the issue of child labor that needs to be addressed, you know. So it helps governments and other institutions to make a decision around programming. So where should we target, how do we target, who do we target? And finally, it also shows progress. So you can tell over time, this is where we started at, this was the situation, this is how it has changed over time or not. So you're able to measure whether your interventions are useful, are having any positive or negative impact, and therefore be able to adjust accordingly. So we avail our data. Actually, currently, the data from the helpline is linked to the Child Protection Information Management System that Don had spoken to earlier from the government. So that is already linked to the government database. There are other partners out here, like Childline, who do various things with children. Unfortunately, that data does not necessarily find its way into the government's information management system, which in itself is a gap, because being the authentic data source or system, then when they're presenting their data, all these other data sets from other organizations doing many things is not included in there. So is it representative enough? I think that's another question we need to consider. So that's how we use our data. I know, I think for the first or second time now, the data from the information management system, the child protection one, has been featured in the economic survey, yes. Which is very useful because it also informs resource allocation for children. Like he said earlier, unless you show the need, nobody will allocate resources for it. No one will plan for it. So you might know, oh, children are really troubled. But that's where it ends. Yes. Unless you can use data to show how much are they affected, who specifically is affected, and so how do we target them to adjust their situation or improve their situation. So that's how we use our data currently. And of course, we have the advantage of working closely with government that way, because then we are also able to channel our data through the government systems a little more easily, I would say, compared to other partners.
Okay. Yeah. So the other question is, it seems the government, our government, relies more on private organizations to give them information that they should look for themselves. An example is Missing Child Kenya, which is a private organization that really looks for information, and it's becoming reliable more than even government in terms of being given that information related to children who are missing, and they are relaying that very fast. Where is the challenge? Where do you think is the challenge, Martha? Even you, as Childline, yes, you work with government, but you're not part of government.
No.
Yes.
So maybe Collins. Yes. There's something we need to just say it as it is.
Yeah.
Government is having the right data.
Yes.
And I don't think government is relying on other people on data. Look at a police station. when a child is missing, right, before we get to know as a public, most likely the village elder knows, because the household, the Nyumba Kumi arrangement has fed the village elder. Most likely the police knows, but what the police will do, they have some procedures that makes them not to go public that something is happening until they verify.
Yes.
Right? So data on anything in the interest of the children, government already has it, a lot of it. So what we should be asking ourselves,
Yes.
how is it being utilized to make decisions or to provide interventions for children? The how is it being utilized? It is not being utilized properly. Reason being, we have a directorate at the national level responsible for monitoring and evaluation, I think under the Ministry of Treasury and Planning, has provided very good guidance. But I'm afraid I have to say this, different departments seemingly are ignoring the advisory from the main government unit responsible for M&E and data, right? Why would you want to set your own data systems? Why is the Ministry of Education having the National Education Management, whatever, NEMIS, National Education Management Information System, about children? The Department of Children Services has a Child Protection Information Management System about children. The Ministry of Health has the Kenya Health Information System around children. There is information around children there. But all these are not integrated in a manner that when you go to a multi-sectoral, multi-stakeholder platform, then you're making use of this data. Now, the biggest challenge, this data is not well analyzed. You read some reports, you actually wonder, is it an analysis or you are just being presented to what the data is? The most recent report by government, Martha, was the child protection, the one that was launched, I think, this year.
Yes, in March.
Yes, very good information. Now, how is that information from the Ministry of Department of Health data being analyzed in the context of what the education data speaks to? Now that we have this number of neglect cases, what does it mean in terms of the education sector data? Does it mean that one system is not speaking to the other? So let's sort out data harmonization and integration. Let's sort out analysis. Then let's look at how the data is informing intervention. Today, the government could be rolling out a program, like the social protection program, the cash transfer program. It has been informed by the number of vulnerable households. Those vulnerable households are vulnerable children.
Yes.
All vulnerable children are children in need of care and protection. Now, the department that hosts the data on children in need of care and protection is under the same state department as the department that drives social protection. Are they speaking to each other internally? So that you look at the data on vulnerable households, meaning those children are in need of care and protection, so that the CPMS data can feed social protection data. It's a problem. And we have the right minds, by the way, in government that can solve that. So I don't even see the need to start saying we need technical assistance from out of government, because government has think tank institutions.
Yeah.
We have Kenya Institute of Policy, KIPRA, Kenya Institute of Policy Analysis and Research, for example. That's a government think tank. We have universities that are funded by government. So why would we have a problem? The same government funds think tank institutions, like universities, for example, but the same government is not making use of these universities to help analyze this data, to help them recommend interventions. So by observation, we are seeing there's progress. But by data, there's a problem analyzing to show that there's progress.
So in short, we are saying, yes, there is data. The problem is the office bearers who are supposed to implement the available information.
First, to make sense of that data meaningfully, then make a decision.
Yes.
Because otherwise, if you have the data, it is not properly analyzed to sort out and find out what the two situations are, then you keep on responding to other things away from the true need that is presented within the data.
Okay. Now, for you, Bonyo, what do you do with yes, I'm sure you are able to access that data as joining forces. Yes. What do you do with that data when you get it?
From lessons learned over the years, right now we are into discussion of government, this is your data. Make decisions as informed by this data. So we are shaping the discussion around utilization of data to make decisions, right? What do we do? As institutions, there's the intervention at the community level where we will say, based on the data around this community, let us collaborate with government to intervene and design a program that then can respond to the needs of the children at that level. For example, if the risks to violations is because of the distance from the household to the water point, and therefore when children move a long distance to look for water, at their risk of violations, maybe kidnap or abuse or physical abuse, then you intervene by providing water closer to the household so that you make children know to move a longer distance to look for water, and therefore the risks to violation reduces. If the problem is food that makes children to be engaged in child labor, then use that to intervene on household income level or food security so that the families do not have to put pressure on children to go to the market to look for work to do for them to get food. Then you're reducing child labor by intervening at the household level food security. If it's around, say, healthcare, if there's increased waterborne diseases, then invest on water to reduce diarrhea and other kind of. Now that's what we are doing as non-government agencies in collaboration with government at the local level. Okay. But at the policy level, this is why we still must do much more. There's a great opportunity. We are having the annual planning of government going on. Unfortunately, Treasury reminds ministries to involve their stakeholders, but for some reason, the stakeholders are not being involved. So you read the report that is informing decision. It is basically, we had this number of children, this number of child neglect, for example. So what? We had this number of absenteeism in school.
Thank you very much, Mr. Don. Now, let's go for a short break. When we come back, we are going to look at the interventions that should be put into place to make sure that, we make use of the available data on children across the country. All right, thank you very much, and welcome back to our discussion on child rights. Now we are discussing issues, data on making decisions related to children, and how can we use the available data to make sure that children receive services. And here I am with Martha Sunda and Mr. Elijah Bonyo. So Elijah, you were making some point about the interventions that should be put into place to make sure that the available data becomes meaningful to children. What are some of the things that should be done according to you?
I think number one is to expose this data to stakeholders that have a responsibility to take action or make decisions. For example, just to give what we've been able to do, we had some information around needs of children associated with COVID. So we identified certain counties for intervention. And at that local level, you bring the information, share it with the stakeholders, and then design the interventions together. Because remember, you need different stakeholders with different capacity to respond. And sometimes the government-led stakeholders. So for me, stakeholder involvement, multi-stakeholder, multi-sector discussion, which is contextualized. Don't discuss response for Wajir in Nairobi. Don't discuss response for Lamu or Busia in Nairobi. The stakeholders here are at that level. The people who are more affected, involve them as stakeholders in designing what will work well for them. And the structures, government structures for facilitating those discussions. At the county level, yes, people look at the county government most of the time. But how come we never appreciate the intergovernmental relations where the national government officials in the county and the county government officials will come together, and community leaders, including children, because they have a voice, and then they design the intervention at that level. So localizing the discussions around interventions is very, very important. The second thing we need to do is to align ourselves to global standards. We have a gap on indicators. We have the Sustainable Development Goals, targets, and indicators. But if you analyze how we are also aligning ourselves, why it's important to align ourselves is because at the end of the day, the standards for measuring rights of the child in terms of progress are global. So the standards for assessing access to education, assessing health or water are global standards. So we also need to align our discussions to the global discussions. The third thing is to invest resources on the interventions, because we can design and stop at the design. So how do you put inputs, both financial and human resources, in a manner that is proportionate to the interventions, so that then we are able to use it, you have utilized the data to design. Have we put the resources to help us implement what we have been able to design? Are we monitoring progress? Are we stopping to reflect with the people, and then we improve together? At the end of the day, we are one people. Yes, we'll have government and we'll have civil society, but we are citizens at the end of the day. Let's localize these discussions around people's problems. That's what devolution is all about, by the way. If you look at the Constitution, I think Article 174, enabling the people to be involved in decision making, enabling the people to take further their own, in fact, the word is further their own development. Yeah, thank you.
Wow. So for you, Martha, how do you feel when you present the data that you've received from callers and your interaction with Kenyans? How do you feel when maybe you present that data and maybe on the implementation part? Are you satisfied when you see maybe you presented that data and you see action or you see no action? What comes to your mind, or what is your first reaction?
Of course, when there's no impact, especially positive impact, after sharing data, you feel like you have wasted time and resources to analyze the data and to present it. And sometimes it's not really your fault. It's maybe the level of understanding of your audience, which takes you back then to do a little more. For example, if I tell a child or a group of children that 20% of children are abused in your county, are they able to contextualize that and understand what I mean? What if I say 1 in every 3 children have been violated, for example? They might understand that better. So depending on the reaction, it gives you an opportunity, it gives me an opportunity to go back and perhaps present it differently. And then also, because of how we are, there are people who are more visual than others. So there are people who would want to see the graph, for example, and be able to actually see that proportion is actually big. And there's another person, as soon as I tell them 20%, they're able to figure it out and create a mental image of the same. So that gives me that opportunity to do a little more so that I make sense to my audience. It's a little more discouraging for me when I present the data to someone. I am sure they have understood it, but they choose not to take the right action within their mandate. Now that is disappointing. because truly there's nothing more I can do. They have chosen not to play their part, understanding the data, knowing their mandate, but choosing not to take action. Now that is more disappointing for me.
And maybe do you have an instance where you presented data and you're expecting action and nothing happened?
Well, several. Like for example, we always need a lot more resources for the helpline service.
And actually, let me ask this. Where do you present this data to?
Various people, to the children themselves, the community within which they exist, service providers, both government and non-state actors, donor community, what we call development partners, referral partners who are the service providers, for example, to show them what is the quality level, how fast are we responding, and what is the quality of service that we are offering. So various audiences for different reasons. Of course, when I'm presenting to the development partners, I'm looking to interest them to perhaps partner with us to provide more funding for our programs and our services for children. When I'm dealing government, perhaps it's around policies and programming around service provision as government. When I'm dealing children, I need to show them how perhaps to prevent themselves or protect themselves from abuse. And in case it happens, what do they do after that? So it depends on the need of the audience and what outcome we expect from them as well.
Okay.
Yeah.
Now, Don, have you? Let me talk a little bit. Ask a little bit about the CPIMS platform, that system that has been created by government. Have you interacted with that system?
Yes. I've interacted with it, and what Martha says is part of what I think I need to make a comment on. Data from CPMS will be presented, for example, to stakeholders. He says the disappointment is that it's not being used for action. If the data in CPMS, for example, tells us we have this number of neglect cases, what do you do with the neglect cases upon being presented to you? There are several actors that are supposed to respond to neglect. Now, we are supposed to use that data to investigate further why neglect, what is causing it.
Yeah.
And it will not be just one department of government. So we need to use that data now. That's the challenge, utilization and decision making. Can we make a decision that we want to investigate what is neglect, what is causing neglect, and then intervene to reduce neglect? So CPMS will give us very good information. The platform where it is being discussed, are we having county area advisory council, for example, in their quarterly meeting, putting on the table the CPMS data specific to their county and agreeing on the action points? It's not happening. At the sub-county level, if you narrow down to this is the situation for this sub-county, there's a sub-county area advisory council meeting. Is that being tabled for discussion? And then, so I think that's the most painful part. There's investment in data collection and these systems, but moving forward with it is what is not working well. So that we're able to connect that because of the data, the platform, the data was discussed, the intervention, the situation has now reduced. The number of neglect has reduced because of the neglect data we have that help us to do A, B, C, D, and therefore it has already reduced. I think that for me is where Martha could be saying the duty bearers have a responsibility to guide the utilization of data.
Yeah.
And there are several examples that we know of. Some of us have been party to those discussions. So let's appreciate the responsibility of different stakeholders and duty bearers to utilize this information. And we also have a responsibility to hold them accountable if they don't make use of the data. Why would you get a whole government official coming to a forum and reading a script with data in January? Then in March, he comes and reads the same thing. Why can't he say that you may recall that in January, I said A, B, C, D, and this was the situation. Having listened to you, we went back as government and I want to report to you that the situation has improved. For example, the data on violence against children, what was read to us in 2020, this number of children A, B, C, D, is what is still being read to us now. So why would you keep on citing 2019 data and we are in 2021. It means you are not tracking progress and you are not utilizing that data.
Well, so Martha, does that mean that Kenyans are very? Are we too quiet? Are we not demanding or accountability from our government officials and maybe the people who are supposed to implement these reports?
Yes and no. And remember earlier in the discussions we are talking about empowering the members of the public with the information. For as long as they don't have that information, they really don't know what the true situation is, and then they are not also guided on how they can play their role to demand for certain things. So it's a whole cradle to grave kind of situation. So we need to start with what information should we provide for the public and at what levels, age appropriate and based on their audiences and their situations. Then from there, someone needs to prepare them therefore on how do you make use of this data to hold someone else accountable, a specific entity within government or organization or whoever else has a mandate, for provision of services or responding to the issues that are presented through the data. Now, when they're empowered that way, they will also start holding you accountable to provide them with data continuously so that they're now driving the agenda. They're asking you, so how many children did you attend to? What services specifically? So they're demanding for the data from you, although initially it might come from you to them. But when they're empowered enough, they're able to push you to give the data so that they're able to play their role to hold either you accountable or someone else who is supposed to do a certain level of response to them. So I think that's how we need to look at this, so that we don't just point fingers at a certain direction, but we also see the whole thing holistically and our specific role in addressing that.
Okay, so as we finalize this conversation, Mr. Bonyo, where can we, or where does non-state players, where do non-state players come together and maybe work with government to make sure this happens?
I think the non-state sector, first of all, needs to sort out some confusion. There's some confusion in the non-state sector.
Yes.
There's a narrative that I'm only collecting data that I need.
Yes.
It's an unfortunate narrative that I'm only going to collect. When you talk about children, don't put your interest first that I'm only collecting data on what I need. What you need as who? You look at the rights of the child as well provided for, comprehensively get data around the situation of children, then at analysis level, make use of what you need. But the non-state actors are then, let me call it competition, around surveys, around researches. The amount of resources that different agencies are using on surveys is huge. What stops non-state actors collectively to approach National Bureau of Statistics together and do an annual national survey on situation of children, and then people come to the national platform where we have non-state actors on the table, we have government on the table, we have donors on the table, and then we discuss situation of children. But apart from that, there's a legitimacy question. Who is the non-state actor representing? There's a confusion. The mere fact that 5 citizens have come together and decided to call themselves non-state actors, whose interest did they come together? So these are some of the things. The accountability question does not just apply to government. It applies in the non-government sector. The national government, NGO bureau, or NGO board, for example, people take returns there, but to what extent are they putting on the table the contribution from non-state actors? How are they sorting out the genuine non-state actors and the non-genuine one? So the non-state actors, I think for me, number one, we need an inventory of a database on who is doing what on children matters in this country. We really need it. Even if it's going to be non-state actors-led process, government has not been able to put a list of who is doing what for children in this country who are non-state actors. National Council of Children Services needed to have a database. Now, it is not there. So even as today, we can leave this place, and in the evening, we have formed a non-governmental organization, and we are working for children, and we move forward.
Yes.
So I think that, for me, is the confusion that needs to be sorted out. government knows what to do. We're just reminding it to sort out the confusion. Because perhaps we could be talking about government, but as Martha says, perhaps the non-state actors could be the problem. I don't know.
Oh, okay, all right. Martha, what's the way forward?
Well, I think for me the way forward is to take advantage of what already exists. Like he has just outlined for us the issue of who is doing what where in response to children issues. And that information is already available. Only it hasn't been put together and used meaningfully. So we need to start from what is available. Actually, from what do we need? What is available? Therefore, what more do we need? And then now, as I had said earlier, engage at different levels, right? From the person, the beneficiary we are serving, in this case, the child, the communities within which they exist and their families. Then now duty bearers, you know, and all other people, the safety net around the child, policies, and go international if we have to. But it needs to be led in a certain systematic way. The truth is, government is the one that is able to bring all of us together to be able to do all those things in an organized manner. So for as long as government is not taking that coordinating role, we will continue working within our spaces, collecting data that we want and using that. And you know, we also have different definition of terms.
Yes.
So I will say I responded to 50 sexually abused children. He will also say he responded to 20 sexually abused children. But when you go into the details, you find my definition of a sexually abused child and his is different. So that data cannot be used together. There's another level of analysis to clean up and to be able to make sense out of it. So all that honestly needs to be coordinated somehow by government so that we are all, one, held accountable, and consistently we measure progress consistently and regularly, so that you can even predict, you know, by December I'll have data on the situation of children in the country. You know, it is very predictable, and you're sure that data is authentic and you can use it in any platform to present a certain point.
Maybe just to add one more before we conclude, there's something that we don't have as a country. An annual, this country does not have an annual status report on children.
No.
Now, what Martha is saying, if we have very good coordination framework, we can actually have a county-specific annual report on children matters.
Yes.
Then you have a national annual report on children matters, and then you will be able to see again in that report who did
what.
The water sector in this country is doing very well, by the way. There's in fact even an analysis of the stakeholders in the water sector who are not government and their financial contribution to the water sector. Now, if that already happens in Kenya, in the water sector,
yes,
which is led by also government officials, why can't it happen
in another sector? Like
so my message this as we wind up is to plead with government and of course National Council of Children's Services to just adopt a culture of annual reporting. You can imagine now we are spending a lot of efforts on reporting to the Africa Committee of Experts on the Rights of the Child. We are reporting the United Nations Committee on the Rights of the Child, which is good, but we are not reporting to our own people. Have you ever seen the National Council of Children's Services presenting an annual report to Parliament?
Now, what do we report even? What do we report? So,
but
yes.
there are efforts toward that, by the way,
yes.
Elijah. Recently, I was part of a process where we were discussing how to get, what data do we need?
Yes.
How are we going to collect it and present it?
You need as who?
As government and as non-state
Exactly.
actors, based on the national
Right.
prevention and response plan.
Yes.
So if that works as envisioned, then we would be moving in the right direction to collect meaningful data and hopefully
I think Martha is doing something that we can't let it go like that. Let me tell you. Now, she's saying
yes.
there is efforts towards that.
Yes.
Now, what I keep on saying, we have the Ministry, Treasury and Planning.
Yes.
There is an M&D department, right? That should be advising all these ministries on what we need to do. It will shock you that the Ministry of the Kenya Handbook, there's a Kenya Handbook on data that requires a country, the
Yes.
data sets for children, a lot of it is missing. Now, what this process needs to do, sort out the mother handbook that they can't, what data
those details, yeah.
that they can't require for children. Then it goes to the main mother ministry that is around M&D. Then you begin to realize which ministry should be assigned what responsibility. But this is a case where a particular ministry has decided to assign themselves. Anyway.
Wow.
Yes.
All right. Thank you very much. So I wanted to give you 1 minute, do I say 1 minute or 50 seconds each, so that you can give your final remarks in relation to the role that donors, religious leaders or religious organizations and civil society can play in making sure that, you know, we realize a better society through the data that we already have, leave alone collecting more that data, but utilizing what we have. For example, we have the survey that was done in 2020, the Violence Against Children report.
Yeah.
I think it hasn't yet been implemented yet. We have that response
The prevention and response plan.
Yes, plan that is already there, but we don't see anything happening around that. 50 seconds, we close.
Yeah, thanks, Collins. I think for me, we have government data. What we need to do, where donors and civil society should invest, is citizens-generated data. So let us give the children a chance. Let's get children perspective of the data, what they are saying. Let's get the citizens. So we have to check government. So yes, we appreciate government data is credible, but what investment we require from civil society, religious organization, donors? Let's support citizen-led data generation and children-led data generation. Then let's be on the table with government. Let government put their data on the table. Let citizens perspective on the table. Then now we move forward.
Martha?
Now to the donor community specifically, they should allow us space to pursue what is useful for us, so that they don't push their agenda down our throats, but allow us to say this is where the need is, and so they help us resource that for it to be meaningful for us. So I think that is critical, and for the religious institutions, it doesn't make sense to keep hiding or burying our heads in the sand. We have certain realities within the community now, which can be addressed in those platforms of the religious institutions, so they need to work hand in hand with government and CSOs, so that we are able to push a certain agenda together, targeting the same community.
All right, thank you very much. That was Martha and Mr. Elijah Bonyo, who have had, you know, these are very experienced people in terms of issues, children, child protection and all that. And I like the conversation. Let us meet again next time, same place. My name is Colin Sorono, and this is Mtoto News. Remember, this program has been sponsored by the Joining Forces Alliance. See you again next week. Bye-bye.